When you're faced with an at-risk pregnancy, it is important to have a structured plan and know what is coming next.
The reason you enter neonatology, I think, is because you get to deal with very sick babies, but what you do from the beginning is to offer hope.
We have this team of doctors, this team of nurses, and then all the other things that go up to make up high-quality care. We have that here.
Even though pregnancy and early preterm labor is not the best way to handle things, and preemie babies isn't the way you want things, it's not the worst thing in the world, and they end up being okay.
kxly-4 HD presents Spotlight on Health, comprehensive care for at-risk moms and newborns. Brought to you by Providence Healthcare.
For expectant mothers, the prospect of having a baby brings excitement and anticipation. While most pregnancies proceed smoothly, occasionally concerns arise, either for the health of the mother or the development of the baby. Luckily for women in our region, Providence Sacred Heart Medical Center and Sacred Heart Children's Hospital offer moms-to-be and their newborns a wide spectrum of highly specialized diagnostic and therapeutic procedures, along with the Inland Northwest's most modern and state-of-the-art maternity center and neonatal intensive care unit. Everything on one site and in one location.
Hello, I'm kxly's Christy Goranson. In a given year, you can expect more than 2,500 mothers-to-be to give birth right here at Providence Sacred Heart Medical Center. What you can also expect is that a certain percentage of those women, for whatever reason, will develop some sort of problem that may affect their fetus, their pregnancy, or possibly their newborn. Offering a reassuring presence, the doctors, nurses, surgeons, and subspecialists who work here bring a team approach in providing expert care from conception to delivery and beyond.
There's really not a whole lot routine about pregnancy. And, even though you hear about perfectly pregnant outcomes all the time, this is what women hear about from their friends, their relatives. Everyone talks about good pregnancies. No one often talks about the complications of pregnancy.
For Douglas Barber, who just recently joined the Providence Maternal Fetal Medicine team at Sacred Heart, his is a position that requires the overseeing of a multitude of pregnancy issues.
A maternal fetal medicine physician provides care for any at-risk pregnancy. So anything outside of the normal for a woman in pregnancy is when a perinatologist or maternal fetal medicine doctor gets involved.
Realizing a problem exists and then knowing the steps to take in regards to a team approach with other specialists is critical to handling these problem pregnancies.
Usually what will happen is a diagnosis has been made, say of a birth defect. A woman would come into my office. We go ahead, we do a full ultrasound evaluation in our office, and I speak directly with the patient about the findings, how this birth defect occurred, and usually the outcomes related to those type of babies. Depending on the birth defect, say for instance if it was a cardiac defect, I take it one step further because I have so many resources here and would have that patient then go on to meet with some of our specialists in pediatric cardiology. So the patient would then go from my office for a full fetal echo evaluation and a consult with the pediatric cardiologist.
What fetal echocardiography is evaluating the heart of the fetus and looking for heart malformations in the fetus. And the reason it's important is because there are some heart malformations that are lethal if not taken care of immediately after birth. So if we find that type of a heart abnormality, then we can prepare the family to be able to be informed before the baby's delivered, and then prepare the NICU, the neonatal intensive care unit, to be ready for this baby, and prepare the surgical team to be ready for this baby, because oftentimes these babies will need heart surgery in the first week of life.
Fetal echocardiography can actually be done fairly comprehensively and with a lot of confidence by about 18 to 20 weeks gestation. And usually the earlier we do it, the better off we are.
Combining the benefits of a number of subspecialists is the fact that Dr. Barber has the resources of the region's only hospital dedicated especially to children.
I think we are really in a great situation to have a children's hospital available. Care for complex defects and problems is very, very specialized. And I think people don't realize at what a high level of care they receive when they come to this institution here. That coordination of care, you just can't get that outside of a setting of having a children's hospital. I have these specialists right here. I can call them, they're right here. The patient gets to see them right at this institution, and we can coordinate their care all together.
For some women, problems with their pregnancies can mean extended bed rest, or in some cases, a prolonged stay here in Sacred Heart's antepartum unit.
I've been here since September 30th, about 6.5 weeks. Pregnancy was pretty normal, and then on that Friday I started having some leaking, so I called my doctor and she said to come down here, and they confirmed that I had ruptured, so they admitted me, and this is where I stay.
Usually a woman would be admitted to the antepartum unit after I've already evaluated her for a high-risk obstetrical problem. A common problem would be early rupture of membranes in pregnancy. A woman then has to be monitored for preterm labor and infection in an inpatient unit. This is where they would be admitted to the antepartum unit. The patient would have a long-term stay with us, and I will usually coordinate her care with a team of hospitalist physicians.
The OB hospitalists here at Sacred Heart, there are 5 of us. So we cover every hour of the day, every week of the year. There is always one of the OB hospitalists here at the hospital. All of us OB hospitalists have been in private practice before, so we've seen a gamut of obstetrical emergencies. Sacred Heart has a wonderful antepartum unit. It's new, it's beautiful, it's very accommodating to people that have to be here long term. We oftentimes have patients that are here for 1 month, 2 months or longer. So we try to take the entire patient into perspective.
Keeping your head on straight is definitely.
It's that approach and a specific plan that keeps moms like Rachel focused on the objective.
You know, as hard as it is to be on bed rest, it helps me get by day, just knowing that every day is so important for his development, and that when he gets here, even though it's early and not the way I planned, I know he's going to be in good hands, and that he's going to end up being fine because of everything that they're able to do now. So
for the patient faced with an at-risk pregnancy, it's a very stressful time in their lives. Continuity and continuum of care provides reassurance to the patient. They do not have to wonder about what the next step is in their pregnancy or the treatment of their baby. We provide that all the way through their pregnancy, to the delivery, to whatever services are needed after the delivery. So most important is that consistent reassurance and delivery on a plan.
even though pregnancy and early preterm labor is not the best way to handle things, and preemie babies isn't the way you want things, it's not the worst thing in the world, and they end up being okay.
The Maternal Fetal Program, offering complete care for mothers and their babies. When we come back,
we have this team of doctors, this team of nurses, and then all the other things that go up to make up high quality care. We have that here.
I chose Providence because I believe a commitment to specialty care is a commitment to the best care. I'm Dr. Doug Barber, and I chose Providence because of a commitment to excellence in women's health.
Find your doctor online at kxly.org.
There are over 5,000 hospitals in the United States, but this year, only 268 were honored with the Health Grades Patient Safety Excellence Award. Just 41 have received the award at least 6 years in a row, and 2 of those were right here in Spokane. Thanks to the physicians, nurses, and staff at Providence Holy Family and Providence Sacred Heart for what you do every day. You've made us 2 of the best hospitals in the country and made Spokane a great place to call home.
If you read Providence's mission statement, it's all about delivering quality care to the patient at all times. I'm Dr. Peter Rinaldi, and I chose Providence because they put the doctor-patient relationship first.
Find your doctor online at kxly.org.
So what happens if your newborn baby, toddler, or child requires surgery, especially life-saving surgery? you'd want the best specialists in the region to work on them. If that's the case, then the experienced team of leading pediatric surgeons housed right here are here to help.
Well, we have pretty much the entire spectrum of specialists, from the general pediatric surgeons that do a lot of chest and abdominal work, pediatric urologists, pediatric neurosurgeons, pediatric orthopedic doctors. So we have a spectrum that allow us to take care of the baby. And since most of us are really good in certain areas but don't know a lot about other areas, it takes the whole subspecialty spectrum to really do a good job.
Dr. Keith Jorgensen should know. As one of the leading pediatric surgeons in the country, he chose to come to Sacred Heart because of that ability to work with such a diverse group of specialists.
Medicine has become a team sport. I mean, there's no way one type of specialist can deal with all the needs of a tiny baby, particularly a premature, but even newborns that have major medical problems. And that's why having a team available where difficult decisions have to be made, it can be made in that context.
You know when you have a good surgeon, and I have just been so pleased to have the surgical team that we work with here. And I have every confidence when I send my patients to them, it's because I know they're going to take good care of them.
We also use specialists like surgeons, specific surgeons specifically for neonatal babies and neonatal problems. We deal with GI specialists to help us deal with some of the nutritional and some of the liver problems that we see in early newborns. We deal with neurologists and neurosurgeons to help us with some of the neurologic and the brain growth issues and some of the complications that the brain incurs when the fetuses are born early. We use almost all of them in the NICU.
I've worked in children's hospitals all my life, big ones. The one I came from in Alabama was a greater than 400-bed hospital and was a standalone children's hospital. And the care we deliver here is equivalent to the care we had there.
It is that kind of care that is demonstrated in the surgical techniques that Dr. Jorgensen has spearheaded as a leader in the field of pediatric, minimally invasive surgery.
Often it's the access that we use that is so noxious to the patient. A big stripe across the abdomen as an incision is very painful and affects the lungs, it affects the heart, it affects how much fluid collects in the abdomen. And so if we can minimize that insult, then we can do the procedure and not have some of the bad things that happen after a big incision. And so that's been my special interest, and it's gradually sort of pervading surgical procedures, and I see it advancing every year. There's no other place this side of Seattle or, say, Salt Lake City or Minneapolis, so that covers a pretty broad swath. There's no other place like Sacred Heart Children's Hospital and what we offer. And I think that every child, every infant deserves the very best. So I would recommend that when your child or your newborn has a problem, this is the ideal place to bring them, because we have this team of doctors, this team of nurses, and then all the other things that go up to make up high quality care. We have that here.
The surgery went just fine.
There's also this sense of a real personal physician. One of the reasons I chose to come to Sacred Heart was because I saw that personal relationship, which I value a great deal, and I think parents do. You know, we try to be reassuring. Sometimes things are pretty critical, and we have to communicate that. We'd like to always say, oh, everything's going to be fine, but we have to be honest, and I find that honesty and integrity is here. And in the end, that really makes parents more secure. They know they're getting the straight talk and not just being reassured falsely.
Dr. Jorgensen and the rest of the pediatric surgeons here really do a truly remarkable job. Up next, working with the hospital's tiniest patients.
The reason you enter neonatology, I think, is because you get to deal with very sick babies, but what you do from the beginning is offer hope.
One great thing about working at Providence is that I have the technology and the support for our type of complex patients. I'm Dr. Carl Garabedian, and I chose Providence because here I can provide the highest level of care to children of our region.
Find your doctor online at kxly.org.
Here, you'll find the only children's ER in the area, the region's only children's cancer program, and the region's only pediatric intensive care. Here, over 120 specialists dedicate their lives to making sure our children don't have to leave Spokane to receive the care they need. Right now, right here. Sacred Heart Children's Hospital. World-class healthcare, just for kids.
As the saying goes, children aren't just short adults. They have special needs. I'm Dr. Judy Felgenhauer. I chose Providence because they see the need for specialized care just for children.
Find your doctor online at kxly.org.
Here at Sacred Heart Children's Hospital's Neonatal Intensive Care Unit, the focused approach is that of family-centered care. With that care comes some of the most critical and technologically advanced services available to this hospital's smallest patients.
Well, first off, welcome to the NICU. It's interesting what we deal with in the NICU because we deal with a gamut of babies. By definition, we deal with any baby who has any sort of illness within the first month of life. And that can constitute a baby born at term that has a surgical problem. That can constitute a baby born 3 months early and has respiratory problems and cardiac problems and issues that we'll have to deal with over a long period of time. So we kind of run the gamut. We run anything from babies born at less than a pound at birth to babies at 9 pounds at birth.
Dr. Barsodi understands better than anyone the critical care taken with these infants, and with that, the approach that is needed for their parents.
We went to a 3-to-1 ratio.
Families that have their babies in the NICU go through what we call a roller coaster. There are, especially if you're born preterm, there's a lot of issues that happen, and these babies are very physiologically unstable. So we don't sugarcoat what's going on with these babies. We really have to have the parents be there with us and understand the severity of what's happening. So, and things can change from minute to minute. So baby could be stable today, and then by 4 o'clock in the afternoon, things have sort of turned on us and the baby's more unstable. And the parents will then be told of the changes and have to be here with us as we sort of work through that. And so emotionally for the parents, it's at one point things are feeling good and things are going well, and very acutely things can change and not go so well, and emotionally that's very difficult on parents. So I don't think her exam's that worrisome. So if she's only having residuals of a third, we're not doing anything. Okay. So I'll check her growth and make sure her growth's okay.
For mom Audrey Shoquist, the realization that her babies were to be born premature and then come to rely on the expertise of the NICU, it came without much notice and no real time to analyze the situation.
Well, I was already a high-risk pregnancy, and I started contracting at 5 months. So we were trying to watch that. And they're called EFFs on their heart, which are echogenic follici, and they're just a thickening of the heart. So actually I had come in for an ultrasound for that. And that's when they told me I needed to admit myself because my cervix had been funneling from the inside. And I think maybe 6 hours after that, I gave birth. So we didn't really have a lot of time to give them steroids or do anything to get their lungs developed. It all happened really fast, to be honest, so I didn't really know it was going to happen like that.
And like most emergency early term births, complications are inevitable.
They were very, very, very sick in the beginning. He had an emergency surgery for a valve perforation. He had a PDA, which is a valve that it stays open in the womb, but when you come out, it should be shut. Well, neither one of theirs was shut. And so hers, she had to have a ligation by surgery, so a heart surgery through her back, and his closed with medicine. So, but he did have the valve perforation. They're 32 weeks old now. We've been here for 57 days, and I'm here every day. And they just keep getting bigger, and
you've been through a lot.
Yeah, yeah.
Again, even in NICU, it's the team approach that is taken that really serves the babies and parents best.
The NICU has an interesting system for taking care of the babies. It's a very, very much a team approach that the nurses and the physicians one's not over the other. It's more we offer different parts of the care to the baby. So you have the physicians, which are neonatologists, who have trained through pediatrics into a fellowship for perinatology and have done 6 years of postdoctorate training to be qualified to take care of these babies. The nurses then have been educated specifically for NICU. Many of our nurses have been here for 10 to 15 years, so not only do they have the formal education, they have the long-term experience of how these babies react. Additionally, we have specially trained dietitians that help us with the nutritional needs of these babies. We have specially trained occupational therapists and physical therapists, so we have a huge team of people that actually interact with the babies.
I just feel completely comfortable. Everybody seems to be on top of things. They're really well about preparing you for what could happen and just the outcome of everything, but everything's been great. All the doctors are great. The nurses are very comforting. If you need comfort or a smile or whatever.
Besides the incredible care that is received in the NICU, it is the unique design of the actual unit that promotes family and privacy, something units of the past did not have.
When the NICU was built 5 years ago, we made a conscious effort to move towards something called family-centered care. Our whole point was that when we take care of micropreemies or any sick newborn, we are also taking care of their family. And so we need the parents to be involved in the care of the baby. So we needed to create an environment where they felt welcomed and part of the care. The way we chose to do that from a structural point of view was to create what were called semi-private rooms. So the traditional NICUs of past were big wards where you would have 8 to 10 babies in one room, and there was some benefit to that, but the parents always felt as if they were in the way. What we did is create rooms where only 2 families were in each room, and they each had their own space. They had a couch to sit on, they had storage for some of their stuff, and there was an ability that as the baby received care, the parents were no longer in the way. There was a place for them and a role for them in their care. And so the whole unit is established that way with the parents in mind.
I actually work as a children's therapist, and in my undergrad I did a study on the NICU. This was probably 10 years ago, 10 or 11 years ago, and at that time I actually had a cousin who was in the NICU. She was born at 26 weeks and was able to kind of get some pictures and kind of study up on what they were doing then, and just kind of knowing what they were able to do then for her. She's 12 now and perfectly healthy. And then also going up to NICU now and seeing all the new advances that they've made since then really put my mind at ease. And so my vision was going into this room where there's all these little beds lined up and beeping going off and noisy and busy and hustle and bustle, and being able to go up to the new NICU and seeing that they're all in their own little room just with another baby, and that the beeping's all on the outside where the nurses are. It was really peaceful in the rooms for the babies, and I was even more relaxed knowing that it was the things that I was worried about were being taken care of.
What I see over the years of practicing the old style and the new style of the NICU is that the parents are more involved with the care of their baby. They have a better understanding of the issues that we have to deal with, and as we sort of work with the babies and help stabilize the babies, they see what's going on.
And what advances, technology-wise, in NICU care does Dr. Barsotti see for the future?
Technology in the NICU is a very interesting discussion point. It continues to evolve. And as the technology gets better, we do a better job in taking care of the babies. At this point, as far as my understanding of where we are with the current literature, Sacred Heart has actually afforded us the best technology to take care of these babies. Everything that we need and everything that is coming down the pike to make things better, Sacred Heart is more than willing to invest in to help us take care of these babies. The interesting thing of neonatology is what we do today will look foreign and archaic 2 years from now. So it's a continually evolving science at this point, and probably evolving faster than the other parts of medicine because we're still in our, dare I say, infancy of this field.
They may still be in their infancy technology-wise, but for the team here at Children's Hospital, it's the people that take care of these precious babies and their drive to see positive outcomes that really matters most today.
And the reason you enter neonatology, I think, is because you get to deal with very sick babies, but what you do from the beginning is to offer hope. I think that's what drives us in the neonatology, is that it's sort of a field that you're driving hope. You're taking these very ill babies, and you can see the 3 months down the road when the baby's going to go home. So as you get nearing discharge, The feeling in the unit is excitement, actually. Everybody, the goal of having a baby in the NICU is to get them home as healthy as possible. So as you get close to discharge, you really begin to get excited about it.
For recent NICU graduates, Ruth and William Gilmartin and their son Finley, coming home was a transition they were prepared for.
Well, he was born 3 pounds, 12 ounces, which was a shock when they first pulled him out and announced his weight.
They told us it would be 3 to 6 weeks, most likely, that he would be in there. So at 3.5 weeks, we were pretty excited. Actually kind of shocked that, oh, he's ready to come home? Wait. I could go on and on, honestly, about the care that they offer there. I mean, there were a lot of different nurses that take care of him, and every single one, they're all a little different, of course, with how they go about things, but under all that, they all have extreme care, like actual love for these babies. And, you know, I could go home at night and trust, you know, that he's okay and that they pay great attention to them.
They were with him for 3 weeks, you know, day in and day out, monitoring him and how he was progressing, and for them to, you know, discharge him and say he's ready to go home. It's like we brought him home. I mean, at least I brought him home already feeling like, you know, he's going to be okay. He's been watched all this time in the NICU, and they say he's ready. So in one sense, I've been less worried about bringing him home.
I think every physician has their own success story. What drives me and keeps me going as far as seeing babies that are very, very ill and moving forward. I remember a family, this must have been 8 or 9 years ago, where the baby was very, very sick, born at 23 weeks gestation, which is what's considered below the cusp of viability in the United States today. And this baby was very, very unstable, to the point where there were many nights where I was called back to the unit to actually do CPR on the baby and help this baby out. And we were very concerned that even if the baby survived, the consequence to the brain would have been large, and this baby would have had a lot of long-term complications. And I saw this baby 2 years after graduating from the NICU, and the baby was walking and running around and acting fairly normal for a 2-year-old infant or toddler. And that just reminded me that I'm not God. I do what I can, and by the grace of God, things get better, and we have to trust that we do the best we can, and we go from there.
For Audrey and her babies, Liam and Lily, that trust means everything.
They're miracle babies.
Yes, yes they are. So, and I can't wait to tell them all these stories when they get bigger.
As you've seen in this half hour, the programs and services here at Providence Sacred Heart Medical Center and Children's Hospital are in place to give every woman the absolute best chance of having a healthy pregnancy and, most importantly, a healthy baby. I'm Christy Goranson. Thanks for watching.